we believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. I just want to reassure you, it's not going to take 30 years or 100 years to happen. It will happen within the next 5 to 7 years. Why I am so confident it's going to happen? Because thanks to the government's policies, very progressive policies, many things are happening which will culminate in access to healthcare to everyone. It took us over 60 years to create 55,000 medical seats. In the last 10 years, our government added 75,000 additional medical seats, which is unthinkable by any country in the world. And with the promise that we will add another 75,000 additional medical seats in the next 5 years. Again, something unthinkable. Just 10 years ago, even metro cities had shortage of specialist doctors. Today, most of the big cities have adequate number of doctors. In a matter of time, before tier 2, tier 3 cities will have the same situation. Few years ago, we had acute shortage of beds. Thanks to the private equity companies, today big cities have more than enough number of beds. We have same number of beds like most of the European cities. We have addressed the problem of skilled manpower, we addressed the problem of beds. But there is a problem. The problem is cost of healthcare is beyond the reach of more than 75% of the population. This has to change, and this is what we believe will happen very soon. One of the policies taken by the government is the opening the health insurance. So hospitals like us could become a health insurance company. About a year and a half ago, we got the license to be the first hospital group in India to become a health insurance company. Now, what difference it makes when a hospital becomes a health insurance company? About 16% of the heart surgery done in India is done by us. Technically speaking, more people develop heart attack, it is better for my business. But when we become a health insurance company, we will work very hard to make sure that nobody develops a heart attack, because that's the only way we can save money. Then our interest and our customer's interest is aligned, then the magic will happen. We believe that health insurance will be available to every citizen of the country, especially 70% of the people who cannot afford to buy the current health insurance. Our plan is to offer health insurance in a manner that it becomes accessible to everyone. Our plan that we approached Reserve Bank of India just few months ago with the idea of launching health savings account. What is health savings account? Many of you may have some domestic help, and when he or she does some exceptional work, we keep tipping them. During festival, we tip them. Now, what do they do with that money? They just spend it on things which may not be required. When all these gig workers, all these domestic helps, construction workers have a health savings account, it's a dedicated zero balance account. Instead of tipping them, you can tip that health savings account of your maid or a driver or any of the gig workers you're dealing with. That money can be used only for the purpose of healthcare, like paying the premium of health insurance. We believe that with the health savings account, with the price of 1 cup of coffee, that's about 15-16 rupees per day, the family can be covered up to 3 lakh rupees with the health insurance. We believe that with 50 rupees per day, that is price of one masala dosa, a family can be covered up to 5 lakh rupees for any of the medical treatment, up to 1 crore rupees for any surgical treatment. This is possible. And unlike in the past, the policyholders can pay monthly premium like a EMI, or they can even pay on a daily basis. Our app will make sure it happens. This will transform the way working class people, the 400 million informal sector employees, look at the health insurance. And that will become a magical impact on the way we deliver healthcare. Now, why have we tied up with Airbound to build this concept of drone delivery? We are building a hospital which will be commissioned in Banashankar in the next 2 or 3 months. This will be the first hospital in India which is completely paperless and smart. In this hospital, only the people who are going to touch the patient are going to work. People in scrubs are going to work. Anyone else other than the people who are touching the patient will be based remotely in our corporate office or some other hospital. And they will be offering all the services required, financial services, HR services, inventory management, everything is done online. Over the last 23 to 25 years, we have spent over $100 million to build this digital platform, which I presume is one of the world's most advanced digital platform, which is totally developed by our Indian software engineers, which is the only software which is built by the hospital itself. So with the digital platform, we believe healthcare will become safer for the patient. The software will prevent doctors and nurses from making mistakes. The software will bring in efficiency and reduce the price, reduce the cost of delivering healthcare. Now in this hospital, there is not going to be a lab for blood tests. There is no blood bank. All these services will be supported by our Health City campus. We have the most advanced lab in the country, one of the most advanced labs in the country, which is accredited by Joint Commission, by the CAP accreditation, a US body which accredits labs all over the world. We do not want we are building quite a few hospitals in Bengaluru. None of these hospitals will have lab, none of these hospitals will have a blood bank. All our requirement of blood tests and blood bank services, everything will be supported by our hospital in Electronic City. And that will dramatically bring in efficiency and dramatically reduce the cost. For us, cost of healthcare has to go down. Contrary to the popular perception, we believe that cost of healthcare will go down dramatically and healthcare will become affordable to everyone. And why we are so attracted to Airbound is because of the philosophy that a blood sample or any sample should reach from point A to point B for less than 1 rupee. And this will be a game changer. Because Airbound is one of the very few drone company which is trying hard to indigenize every component of drone making, and that will be a game changer. It's our privilege to work with them, and we are waiting for the clearance from the government for us to fly from Banashankari to our hospital in Electronic City. Fortunately, it is in the green corridor, so we don't expect any major hurdles. Once this happens, we start the pilot, and hopefully it will become a super duper success so that eventually many other hospitals in the country will start centralizing all these services. So there is no need for every hospital to have their own blood bank and their own laboratories. Thereby, centralizing will reduce the cost, it will make it efficient. Like in the hospital, our Electronic City Hospital does 25,000 blood tests every day. When we do that many tests, the cost per test will go down dramatically, the results will get better, and this is the advantage of centralization with all these modern technology. I would like to congratulate the young team of Airbound, and it is our privilege, we as a group of running hospitals in India and outside India, want Indian startups like Airbound to get into these exciting areas and make an indigenously developed product which will have a massive impact on every aspect of our life. Thank you so much for your support and encouragement. Thank you.